Okay, hi. This is Cooper. He'll be my patient today. We're going to be doing a 4-quarter draping for his spay. I know he's a boy, but we'll have to do. So normally for this, they're placed in a dorsal recumbency, and for a spay, the surgeon will make the incision from the xiphoid to the pubis. And then we'll place the drapes about 1/2 inch to 3/4 of an inch away from the incision. I haven't really seen one done in real life, so I read a few different things about it on the book and watched a couple of different videos, but I'm not sure what's actually like the golden standard rule. But I'm using little towels. I'm not using like the hardcore like big bath towels because I think that'd be too big, and I don't have like any towel clamps, so because he's small, and everything will be off. So what I read was that first thing you're going to do is you're going to grab your first one, and you're going to place it, like I said, 1/2 inch to 3/4 inch away from the incision, and you're going to start with the both lateral sides first, but you're going to start with the one closest to you, like your side. So what I read in when I watched the video on is that you grab your towel. This is the one that I got. I read a video that I watched one that said that you will fold it over, and then you'd use Dr. Jordan showed us this last week, I think, but you do the whole like fold over, so it's like stretched, and then you'd place it here. That's what I watched a video on. When I read in the surgical book, it didn't go into detail on that, so they just said about the aseptic technique. Don't let it touch you, don't let it drag on the floor, don't reach over the patient or the sterile field. So I'm just going to do as if I feel like this would be right. So I'd be placing it first the lateral part. Don't let when you're grabbing it, don't let the towel touch you or anything else or the ground, and then lay it 1/2 inch to 1/4 inch away from the incision. First the lateral side that's closest to you, then you step away from the patient and walk all the way to the other side. Don't know if I should do that, but anyways, that would be next. So I'd grab my next one, which is different color, and then I'm gonna reach over because it wouldn't stay. I don't have towel clamps, so I don't know what to do. So then I'd place it on the other lateral side, and I folded them for this purpose. Okay. Once both the laterals are done, then you do the cranial drape next. So you would walk over, grab your next one, fold it, and then it'd be like here. And then what I read in the book was once you have your cranial drape on, that's when you'd use like your towel clamps, and you would clamp, here on all the corners to make sure it's pressed down. And once that's done, then you would do your caudal drape, which would be your last one, and then that one would go, and you'd place your towel clamp, and then there should be a final drape, which would be the one with I think it's called a fenestration, with a cut in the middle already, because once you put the drape on the patient, it's kind of impossible to cut it sterilely. So that should, once that's done, I did not grab another towel, but say this tissue is my final one, I would, if it would be out folded, and it would have a cut down the middle, and then we would place that on the very top. That's what I read in the book. I don't know if I have this right. And then there would be a cut already in the middle, and then you would place more towel clamps to finalize, to hold it down. So that is what I got from the 4-quarter draping. I remember we wrote about it in clinical surgery and lab. I got a good grade on the assignment, so I was gonna assume that I did well on that part, even though there wasn't feedback. So I kind of use that as a study guide reference too in the books. So hopefully that was right. Okay, that's all.